Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome back. This is a place where students should feel supported, grounded, and reminded that you are absolutely capable of doing the hard things. I really appreciate being your host. I'm an educator, a content creator, and your official or maybe unofficial support system cheerleader, hyping you up. Today, we're going to take a dive into the question I've been hearing nonstop from people on TikTok and even some of my own students. Is the national board getting harder? So students are DMing me, they're emailing me, they're asking me in class, all with the same fear, really. And I get it. When you're staring down the biggest exam of your academic life, every single rumor feels like a threat, right? Everything you hear sets doubt into your mind, and that can actually make or break you. So you need to recognize that. So today, what we're going to do is we're going to break this down with clarity, honesty, and even more important, strategy. Not fear, not panic, just facts, perspectives, and honestly, a game plan for you. By the end of this episode, my hope is that you'll understand what's actually on the board and how it changed from last year, what's just noise and rumor out there, why the exam feels harder to students who are taking it, and really how to study in a way that protects your confidence, because that's really the deal maker or breaker. So let's get into it. So first, let's talk about the elephant in the room. The reality is the NBDHE, the national board, has always been hard. It's long, it's dense, it's concentrated, it's mentally exhausting. But the perception that it's getting harder is coming from a few real places, okay? So the board exam itself has definitely shifted over time, but you can argue whether or not it's harder. But here's what I want to say. Students who have taken the board are telling me that the case-based questions feel more medically complex. They feel more layered, and they feel like more real world patients. Okay, and honestly, that's intentional. The exam has shifted toward clinical reasoning, not just memorization, right? They are testing the skill of, can you think like a dental hygienist? Can you mitigate risk? Can you evaluate the different strategical things that you need to do to alter care or plan care or, come up with what's the proper thing to implement, right? And that is what the board is testing your knowledge on. Can you think like a dental hygienist, like a provider that is providing care to patients? So I will say that as dental hygiene programs, as a department chair myself, programs are emphasizing critical thinking a little earlier in the program. So faculty are seeing that there's a shift in the clinical reasoning evaluation part of the exam. So as a result, the faculty are raising the expectations because the profession is raising expectations. And I think that elephant in the room, that students feel the shift. And it shows up in how you interpret the exam when you take it. We can't just disregard it or ignore it. But I will say that I do think that faculty are doing a really good job at pivoting, because it's about preparing and planning our students and really giving them all the tools that they need in order to be successful. So it's such an interesting time in our profession. It's like part of my charge is to support the need to keep the board exam implemented and strong for our profession. And isn't it interesting that we're raising the expectations because our profession is raising expectations, yet it's in danger at the same time. This is just such a really weird time. But here's what I know. When you do something meaningful and it's hard, you're actually building advocates for the next generation, because I do believe that when students see how hard they had to work and what is truly the value created in this exam and testing your knowledge and clinical reasoning, you're going to care about your profession all the more. That is going to be a meaningful license to carry and that will continue to evolve. So bring it on. And I know you're all capable. And I'm not going to lie, social media amplifies fear, right? You see TikTok saying that the boards are impossible now, and suddenly your nervous system goes into fight or flight. So maybe you can use that as a study resource. Is that sympathetic or parasympathetic? So it's almost like when someone gets their wisdom teeth out and they have a traumatic event, those are the ones you hear about. But most people get their wisdom teeth out and don't have any complications or problems. It's usually the people who quietly pass, don't really post about it. But people who panic about their board exam, it kind of amplifies the fear for others. And this is unintentional, because sometimes we share our grief or we share our challenges, and that's fine. And then another component that we can't, ignore is that students compare themselves to really unrealistic standards. If you think about what it's like to be a student in today's world, you're studying while you're juggling clinic with competencies, patience, maybe you have a job, maybe you have a family. Of course, it feels harder. And maybe it is. Maybe you are carrying more than students did a decade or 2 decades ago. I don't know. I know that when I went through dental hygiene school, it felt incredibly hard. What? I really don't know, but it doesn't matter, honestly. The experience feels the way that it feels to you. But that does not mean that the exam is harder or that it's impossible, right? So, what is actually changing? And there are some things that have changed on the national board. And I did just do an episode about this. It's important for you to know there is more emphasis on integrated thinking, right? The exam, the test constructors, the people that are writing these questions, they're leaning into this. They're leaning into the medical histories. You have to be solid in your ASAs. You have to be solid in your hypertension. What do the numbers mean? Think about that. What are the things that increase the risk of managing your patient? Because they are testing your critical thinking, and do you have the capacity to treat this patient safely or know what would show up on the medical history that would be something you have to pay attention to? Think about that. I mean, I don't think that's unrealistic for them to expect you to critically think about things on the medical history. They're leaning into pharmacology connections, and rightfully so. We have many states. I mean, now actually Delaware was the final state to allow for local anesthesia. So think about that. If we're allowing hygienists to give local anesthesia, the expectation should be that we understand pharmacology and the connections of certain drugs with local anesthesia, the connection of certain drugs with periodontal disease risk, the connection of certain drugs with caries, right? If we're managing two very distinct diseases, periodontal disease and caries, then we should be well versed in our understanding of pharmacology and the connections that they have. We should be well versed as students on risk assessment. What things contribute to increasing the patient's risk of both of those diseases or one of those diseases? But you need to know the integration of how everything weaves together for that patient. There is more emphasis on interpreting radiographs, which I think is such an interesting. I just had a great conversation with a student, and I was so proud of her for thinking about this. She came to me and she said, I don't understand why we have to note decay on the dental chart in clinic because we're interpreting our radiographs. If caries shows up on the radiographs, we have to note that decay on the dental chart. And if I don't, I get points taken off. And if I do, I'm actually breaking the law, which I thought was a great question for the student to ask me. It's such an interesting world, isn't it? We have to interpret radiographs. We have to know how to see the decay. We have to know where the decay is. We have to know what the treatment is for that decay. But yet, by rules, by scope of knowledge, we get it. We can see it, obviously, and we know what it needs for restorative by knowledge. But by rules, by laws, we're not allowed to actually put it in the record until the doctor says, yes, put that in the record. So it's an interesting place to sit in the middle as a faculty member. You know that the expectation is for your students to be able to interpret radiographs, and that the dentist expectation is that your hygienist knows how to interpret radiographs, but yet the law states that we're not actually allowed to document any of that stuff. So I really hope that at some point we come to terms with how we educate, what we need to learn as dental hygiene students, and then what we're actually allowed to implement in the clinical setting. And I think interpreting radiographs is just one of those areas. When I look at all the time that students spend on interpreting radiographs and doing radiographic interpretation, I know that by the time they graduate, they can see all the bone loss, they can see the changes in the crestal bone or the triangulation. They can note any kind of anomalies, and they certainly can find decay on radiographs. So my hope is that that scope of knowledge and scope of practice comes together at some point. But they are definitely integrating that. They're leaning in on your ability to interpret radiographs. We'll deal with the scope of practice another day. So there's also more emphasis on prioritizing care. And they're going to expect that you understand the order in which patient treatment plans are put together. So we know that we have the patient's chief concern, but we want to prioritize pain, then infection, then restorative care, right? So pain, then infection, then restorative needs. So you have to know the order of things. And if the patient has a chief complaint, and if you need a med consult to make sure this patient is safe to treat, when, what, and how, you have to know all of those things. So I got to tell you guys, this is not new. All right. But it's becoming more intentional. It's becoming more consistent in the board exam itself, in the case-based questions, which I appreciate. I actually think that this is the right way to go. I think students who can read a case study and answer 10 or 12 questions along with that case study that goes to that patient, and they can just visualize and pretend that they actually have this real live patient in front of them, it's going to go a long way at like really connecting the gap between patient care and knowledge. So I think it's good. I think it's good. Instead of like somebody being textbook perfect, because none of the patients are textbook perfect. The textbook either, here's the thing. The textbook, all the pictures in the textbook are like extremes. Like you see mandibular tori, they're extreme mandibular tori. Or if you see black hairy tongue, it's like, goodness, that's extreme. I will say that I think that the case-based questions, I think that the test constructors, the people writing the questions, are trying to make them more realistic. You know, are you going to see an 84-year-old female with osteoporosis who's a type 2 diabetic, who's taking metformin, who suffers with angular cheilitis and dry mouth? Yeah, you are. Who has an ill-fitting upper denture? Yeah, you probably are. So lean in on that. Know that they are looking at what are 12 to 15 of your typical patients that you would see as a hygienist in a given week in a routine practice, right? A general practice. They're going to give you an adolescent, right? Maybe an adolescent with gingivitis and a high caries risk who has asthma or something. I don't know. They're going to give you maybe a woman who's going through menopause, right? Who maybe has some nutritional deficiencies or who knows, hormonal issues. Think about all of the different groups and types of patient experiences that you've had while you've been a student enrolled in school. They are going to give you patients who have multiple systemic conditions, and you have to kind of connect the dots on those conditions and how they relate to the treatment that you're going to put out there, the treatment you're putting together, and what kind of alterations do you have to make to that treatment. And then they're going to give you cases where there's medications with interactions. Does that medication make it so that you have to modify the time of day you see them, or ask additional questions, or be sure that they ate, or avoid putting them back too far, things like that. They'll probably ask you questions that are in alignment with an ethical dilemma or the social determinants of health. Or maybe there will be incomplete information and they'll ask you, what additional information do you need? And honestly, this is not all like to make it harder or to trick you. It's honestly more real life. It actually mimics real practice as a dental hygienist, right? It's actually preparing you or testing your ability to do the job when you get out there. So I think they're moving away from the pure just recall and regurgitation of memorization of content. Like you're not being asked what is the definition of XYZ. You're being asked what would you do with this patient sitting in your chair, which I think is a good thing. If we really want to think about the integrity of our profession and what we really want to measure on this board, it kind of makes sense, right? I do think that the exam is aligning more with modern dental hygiene practice. So think about how much the profession has evolved, right? We have standards that tell us that we're building on more autonomy, although I really like to see that blossom a little faster. We're looking at more medical integration. Like, can you call the physician? And when you call the physician, do you need to call the physician first? You got to figure that out. And then when you call the physician, what are you going to say? What are you going to ask? What are the right questions, right? So there's definitely more emphasis on critical thinking. So there's also more responsibility on the dental hygienist in patient management. So it's actually, I feel like, long overdue. I feel like the exam is just finally catching up to what the profession looks like in this day and age. So yes, the style is shifting, but the content is still the content that you've been learning all along while you're in school. So I'll tell you what I think, why the exam feels harder, even if it isn't. Let's talk about psychology for a moment, right? By the time you are studying for boards, and I distinctly remember this as a student, you have survived clinic. You've survived a laundry list of competencies. You've somehow managed to survive radiology, perio, pharmacology, community, medical emergencies, oral anatomy, head and neck, all the cranial nerves, all the things, right? And the emotional roller coaster of patient care, that's in a category all by itself because you're learning how to be a dental hygienist. The reality is your brain is exhausted and everything in life feels harder when you're tired. So I do feel like obviously the national board exam has to come at the end of your journey, but I do think that that kind of exacerbates the feeling of it being hard, right? You're studying in like a pressure cooker. You're not just learning the whole time that you're learning with the fear of failure hovering over you. So it really changes how your brain processes the information, you know? I tell students when they first come into the program that you're not just learning this information to pass this class. This is stuff that you have to know and be able to recall with patient care for the rest of your career. So it's crazy. And then I know I talk about this all the time, but comparing yourself to others, when you see your classmates finishing practice tests faster, or maybe someone schedules their board early and they get a high score, or you see someone that studied for 8 hours a day and you're not studying that much, or you just can't get yourself to actually sit down and do it. That comparison makes everything feel harder. So, and the other thing, you don't want to interpret normal challenge as danger, right? So the exam is supposed to be challenging, but your brain, by the psychology of it, it reads challenge as a threat. And that's where the fear starts to come in. So then you start like saying things to yourself that are unhealthy for you to actually produce a good outcome on the board exam. So all of those things just get in your way. All right. So let me tell you what you should just focus on. Here's the truth. The NBDHE, it's not about knowing everything. Like I said, it's about thinking like a hygienist. So let's just forget about all those things that our brain does to send us down the river of the wrong direction and focus on the why, not just the what, right? If you understand why a medication matters, or why a condition changes your care plan, or why a radiograph shows what it shows and how you can correct it, right? You are definitely going to have questions about radiographs like, there's overlap on this horizontal bite wing. How do I fix it? Or there's elongation on this periapical. What do I do different next time? So why a radiograph shows what it shows and then what you can do about it. I promise you, if you know why a medication matters, why a condition changes your care plan, why a radiograph shows what it shows and how to make that correction, and really like what are the needs of your patient and what are you going to do about it? If you know those things, if you understand completely those things, then you can answer any question that they give you. So it's really that simple. Don't make it harder than it is, right? So here's what I don't want you to do. I don't want you to just memorize facts. I want you to practice. Do some of the case-based questions. Do some case studies that are out there and figure out how you interpreted the data. Remember, when you do that assessment, you're gathering a bunch of data about your patient. And then how do you interpret that data? That is what they're going to ask you about. And how do you prioritize the care? And at the same time, how do you identify the risks associated with your patient? And how do you connect the medical history to the dental implications? Those are the questions you should be asking yourself when you practice those case-based questions. And here's the other thing. I love habit stacking and I absolutely love studying in layers. And I tell students to do this all the time. So habit stacking, like make your house a study place where when you go into this room, I have this one student and she told me how she learns and I told her what I thought was perfect for her. And I think it's a lot of people. Take a poster board and put it in each room in your house, and you're going to write down key words because you need to study in layers. Maybe if you draw a picture in one room and you have a list in another room or a concept map, right? Because you have to study in layers and do this habit stacking. You've got to just like entrench yourself into the content. Start with the foundational knowledge, all right? And then move to the application. Then finish with full-on practice tests. And oftentimes students do this in the wrong direction. All right, they'll just start taking practice tests and they're trying to figure out where their gaps are and then just try to fill in those gaps. I promise if you take the time to study in layers, start off with each subject. And honestly, you could probably use ChatGPT and say, I'm taking my test on this date and here's where I am. These are my challenging courses. Can you set up a study plan for me to study in layers, starting with foundational knowledge, move through the application, and then finish with full practice tests? And ChatGPT would probably develop an entire study plan for you. But here's what I will say. Don't skip the boring topics, right? Students love to skip community, ethics, infection control, research, and documentation. And that just hurts my heart. Now, community has its own section. You've got to understand program planning. You've got to understand research. You've got to understand data and interpretation and the different types of research that go on. You have to understand infection control, proper documentation, and ethics is huge. So don't skip those topics. I don't know why students love to skip those topics because they yield high returns and are very predictable. Here's what I know. All 5 of those things are going to be on the exam. Why would you skip them? Okay. And the other thing I will say is try to do things that build your confidence. Confidence, it's not like a trait that people have. It's actually a strategy. When you believe that you can think through a question, you perform better. And oftentimes when I'm tutoring a student, that's where I have to start. I have to start with their confidence and find out where they are with their confidence level because confidence is just as important as the topics. So when you believe that you can actually work through a tough question and not just guess and move on, perform better. You do better on that question and then you move on. So what I want every student to hear is that if you take nothing else from this episode, take this. The NBDHE is not a measure of your worth. It is not a measure of your intelligence. It is not a measure of your future success. It is simply a test where you can think critically, apply what you know, and make safe decisions on the patients. Now, you've been doing that every day in clinic. You are way more prepared than you think. You are way more capable than you feel. And you are absolutely ready for this next step. Now, if this episode helped calm your nerves or gave you clarity, share it with a classmate who's spiraling right now. Remember, guys, we rise together. And if you want more board prep support, flashcards, planners, TikTok breakdowns, or deep dive episodes, you know exactly where to find me. You've got this. You're closer than you think, and I'm cheering for you every single step of the way. Have a great week, you guys. I really appreciate you all.